Pennsylvania Hospital was founded in 1751 by Benjamin Franklin and Dr. Thomas Bond to take care of the sick, poor, and the insane. Pennsylvania Hospital has provided the setting for many firsts in our nation, as well as many other noteworthy medical, historical, and cultural milestones. In 1803, Pennsylvania Hospital established a lying-in or maternity department, as some may call it. Pennsylvania Hospital is noted for its many firsts in the area of women's medicine, especially in maternity. The Pennsylvania Hospital's medical library is the first, as well as the largest and most important library in the United States. It is the oldest hospital in America and the first. The first patient was admitted in 1752. The top floor is the home of our nation's oldest surgical amphitheater, known as the dreaded Circular Room. The amphitheater served as an operating room in 1804 through 1868. Surgeries were performed on sunny days between 11 a.m. and 2 p.m., since there was no electricity at this time.
Benjamin Rush studied at the College of New Jersey, now Princeton, and received his bachelor's degree from the institution in 1760. Upon returning to Philadelphia, Rush studied medicine under Dr. John Redman from 1761 until 1766, when he departed for Scotland to finish his studies at the University of Edinburgh. In the summer of 1793, yellow fever spread throughout Philadelphia, resulting in thousands of deaths. The disease, which is caused by a virus carried in mosquitoes, originated in Haiti. The ongoing Haitian Revolution forced many French refugees to flee to Philadelphia, bringing infection with them. The port through which the refugees arrived housed many mosquitoes that helped spread the disease to healthy Philadelphians. Yellow fever causes pain in the head, back, and limbs, accompanied by a high fever. These symptoms soon disappeared, creating a false sense of security until a more extreme fever returns several days later. The victim's skin and eyes turn yellow as they vomit black clots of blood. Many people fled the city, leaving those who could not afford to leave to suffer. Philadelphia became a wasteland as more and more people died. Sanitation deteriorated and food prices rose.
Unaware of the relationship between mosquitoes and fever, doctors desperately tried to find cures. They used various herbal remedies to no avail. One popular treatment practiced by Dr. Benjamin Rush was bloodletting. Dr. Rush believed by cutting his patients to flush out their blood released disease toxins. Oftentimes, he bled his patients until they passed out from blood loss. The public was rather skeptical about his remedy until Dr. Rush himself contradicted the disease, and using his own practices was cured after a week. After this supposed miracle, Philadelphians sought after Rush for a cure. Rush claimed that 8 out of 10 patients saw improvement after bloodletting. The yellow fever outbreak eventually subsided as the weather became colder and the mosquitoes died.